But
Okay,
no,
we're recording now, so don't say anything bad about Andrea.
I, I don't want to detour from your beauty, so I'm going to get off camera.
Thanks, Andrea. Okay, so what we're going to do now is we're going to go live into the system and we're going to walk through those three phases Andrea discussed. We're going to develop a quick little operational plan. And like she mentioned, we're going to use the example of tobacco cessation. So we're going to build the plan out in the system. Once we have the plan in there, we're going to be executing the plan and walking it through its life cycle so we can see the various tools at the macro level, the micro level, and how we would share it via the web. Um, and then after that, we're going to walk it through that PDCA cycle so we can see how we would make improvements to the plan. So we have this little demo organization, get back over here again, called USA Public Health, and I will take you live in there now. Some of you may have already been in the system, some of you may not. We're going to walk through at the end the entire login process, how to change your password and everything, and get through some of the quick update features. But first, we're just going to, as Andrea said, we're going to give you an overview of what it's about. Now, attached to the meeting request that you guys got, there's a bunch of little documents. There's a syllabus for what we're talking about today. There's a set of the slides in a notes format. So the slide is at the top and a place for notes if you do want to take any notes in there. So just, know that that's in there. And there's also a document on logging in and changing your password, which we're going to discuss towards the end. So Andrea had mentioned that there's a set of tabs across the top, and that's that pyramid you just saw flipped on its left side. So the organization, typically there's just one under there, and that is your department. Underneath that, you have a set of groups, which is your divisions, your offices, your programs, plus what we call the primary plans, or what FAB calls their six-pack of plans. The minimum plans required for accreditation are typically big enough plans that they're individual groups. Each of those groups then has its own set of services or initiatives. Services being ongoing programs, initiatives being future programs. Each service or initiative has its own set of high-level goals. Each high-level goal, a set of SMART objectives, and then each objective, a set of activities. So I'm going to go back to my groups tab here. Now you notice when I clicked on this tab, it took me right to community health. Everybody is assigned to a default group. So if I'm the health director, I'm probably up here at the department level. You notice under the department is level one always. Underneath the department, we have these level two groups, which is, again, what FAB calls their six-pack of plans. So you're typically going to start out getting those plans in the system. And then you may have a group like administrative services, and then you'll see there's level three groups under there reporting up. So finance, HR, and IT are part of administrative services. Down here, community health is my default group. So for today, I'm going to be the community health director. And you'll see underneath there, we have tobacco and WIC. So I'm going to go down to my tobacco group here, and I'm going to drill down to the services initiatives. And since I've selected tobacco, the services initiatives are specifically for the tobacco group. So I'm filtering down the pyramid as I'm going. So you see, these are the initiatives that we're looking for. So we're calling these future programs: tobacco cessation, secondhand smoke, tobacco initiation prevention. Under tobacco cessation, then, we're going to have a set of what we call high-level goals. And here they are: reduce smoking in high schools, reduce smoking in colleges, reduce smoking in public areas. Now, when I say these are high-level goals, if you look at that, if I tell you we're going to reduce smoking in high schools, everybody knows what that means. What it doesn't tell you, however, is where are we going to start? Which high schools? When are we planning on doing this? By how much are we planning on reducing it? So at this point in time, again, it's just a high level. Now you'll notice at this point we also set the traffic light out here. So the traffic light is available at the goal, objective, and activity level, and it's just a visual status indicator. And you'll see down here there's actually 4 traffic lights, and they're just exactly as you'd expect. Green is go. Everything's moving along as expected. Yellow would be something is slowing us down. Maybe Fred is going to be retiring at the end of next month and we don't have a replacement yet, so we're going to mark it as yellow. Red would be, hey, Fred just walked out the door. We don't have anybody to run the program. We got a problem here. And then the gold bar would indicate successful completion. The gold bar can be at any level, the goals, objectives, or activities, if you've completed a specific section of a plan in there. Not everything will get to a gold bar. Some things are ongoing, obviously. Now, under the reduce smoking in high schools, we have what we call SMART objectives. If you Google SMART objectives, you're going to get 100 different definitions. I'll just give you ours: specific, measurable, attainable, relevant or realistic, depending on your choice, and time-based. Now, if it's not attainable or not realistic, why go after it? So we kind of leave those two out: specific, measurable, and time-based. So here's an example: reduce smoking at my alma mater from lovely Dayton, Ohio, Wayne High School, by 25% by the end of the school year. So specifically, we're going to reduce smoking at Wayne High School. Our measurement is by 25%, and by the end of the school year is our timeline. So we fit the category pretty well here. In order to get to that point, we're going to assign this person called an objective lead. Steve Hansen is our objective lead. So Steve's got two jobs. Basically, he's the program manager to get us to this 25% reduction. And secondly, he's the guy who's going to update the current status down here in the bottom left corner. Now, the way he's typically going to do that is through what we call real-time planning. Very simply, it's an automated email notification that goes out to Steve. In that email is a link that takes him right back into this objective so he can update it. Now, as you're doing updates to the system, whether you're changing this, changing the traffic light, changing the actual objective, you're probably going to put a note down in here as to what you did. So this little button right here gives you a time and date stamp, as you can see on the note, and the person who did it. And it says add a 25% plan reduction. Well, anytime you make a change, you're going to put a note in there. That way, anybody looking at it doesn't have to call you up and say, hey, why did you mark this as yellow or whatever it is? It's going to be evident in the notes field. One of the other things we added over COVID, well, you guys are out saving the world. We had a lot of extra time. Andrea likes to say we had a lot of dust bunnies in our email. So what we did is added a bunch of features to the system that people have been asking for. One of those is data source. The data source is where am I going to go to get the information to update this particular objective? So in this case, we're going to say it's the CDC Smoking Cessation Fast Facts webpage. And to get there, I just click on this little link button right here. Pops open a new browser window, as you can see, and takes me right exactly to that web page. So the idea here is if you have a place on your intranet, your internet, your file servers, whatever, you can put a link in there to that, and you can pop that open and know exactly the current status in there. So it helps you to keep things up to date very easily without having to go searching too far. Now, the objective, as you can see, is to reduce smoking at Wayne High School by 25% by the end of the school year. That's a great target, right? Has no idea on how we're going to get there. That's what the activities are all about. Activities, or a lot of people call them action steps, are the steps we're going to go through that we believe are going to get us to that target or the objective. In the dashboard, there's three distinct types of activities: project-based, quality assurance, and quantitative measurement. I got an example of each of these we'll go through. I'm going to stay at a fairly high level on these today because the next training, which is operational planning and development, we're going to walk you through the excruciating detail on all these different types of activities and what you can do. There's a lot of different cool options you can do here. So our first activity here is create training content and materials for students and faculty on the dangers of smoking. We're calling it a project-based activity. To me, it sounds like a project. We're going to create some PowerPoints. Maybe if we got video capability, we can do that. User guides, whatever we need to do the training. Every activity's got a performance metric. How do I know when I've successfully completed the activity? So if we're creating training content, once we finish creating the training content, the activity is complete. And you can see the gold bar over here indicating that it is, in fact, 100% complete. We have a beginning and ending date. So this is the initial time frame we set. And, these things can be moved around. Typically, if anything moves, it's the ending date based on, real life happening, COVID or whatever happens in there. Now, our measurement in this particular case is just merely percent complete. So you can see right now it says we're 100% complete. If you go down and look at the notes field, you can see that Diane Cox put a note in here. It says completed chapter 1 back in January. And you can see that the total is 4 chapters. So this is probably sitting at 25%. Chapter 2, 50, chapter 3, 75, and chapter 4, 100%. So that's the very simple measurement in this particular type of activity. Now, in order to get us to there, we're going to assign a team of people. That's this little pencil icon next to the activity leader and team members. I click on that, and then I open it up to the whole department. You see the 3 columns. Team members, so you see we have 3 folks on the team. We have 1 team lead, Diane Cox is our lead, and then the email notification. This is that same real-time planning email that Steve is getting. So Diane is going to get an email with a link back into this activity so she can update how far along is the team in creating the training content. Over here on the right, FTE, full-time equivalent, seldom used, but really powerful tool if you're going to be looking for grant dollars. How much do you need? Going to put it in your budget for next year. What's it cost to do this program? So what you're basically doing is saying during the period of this activity, Diane is putting about 10% of her time, a 0.1 FTE, and William's about a 0.1, and Andrea's about a 0.3. So if I take that and roll it up to the activity level, it shows that we're at a 0.5 FTE for the activity. And if I roll up all 3 of these activities to their objective, you'll see down here it's a 1.0. So if you take that 1.0 FTE and multiply it by your average burden labor cost, you can get a pretty good idea of what it's costing. And then obviously you can put that in your budget for the next year. So again, that's typically where that's used, and it's not used, again, very often. Down at the bottom here, we have activity partners. These are external partners you're working with. So in this case, you see we have several partners, and we've selected VMSG Dashboard, the company, and Fred Erickson at VMSG Dashboard as the specific contact. So you can have as many partner organizations, and each one can have as many contacts as you want. And you can assign as many organizations and as many contacts to an activity as you want to. Typically, it's one or two external partners in an activity like that. Now, you can also make Fred a licensed user in the system, and that way he can get the email notification and go back in and do the updates without you having to go play phone tag and that sort of thing. So it just helps you to streamline the process a bit here. So that is our first activity, is creating the training content. The next activity then we have is we're going to take that training content, we're going to go to the schools, and we're going to provide 9 training sessions each month on the dangers of smoking to students and faculty. This is what we call a quality assurance activity. Just kind of an FYI, it's the least used type of activity because it's for a very specific need. Number one, it's cyclical. So it's something we're measuring in a given time frame. And that cycle can range anywhere. We call it a frequency. It can be anywhere between weekly and every 5 years. We've selected monthly because we're doing training sessions monthly. The second thing that this one does is automatically set the traffic light based on the values you provide. So we're saying if we get to our 9 training sessions, the light is green. And we picked a number of 6, just saying, hey, if we only get to 6, that's not good enough. We're going to call that red. And then it'll calculate 7 or 8 to be yellow in here. Now you notice it has a beginning date and no ending date. So if I have a beginning date and a monthly cycle, then obviously the ending date is going to be like 5/14 of 24. And then it's going to move into the next month, starting at like 5/15 and move into the next month. So it kind of automatically moves that ahead for you. So that's activity number 2. And in this case, our measurement is merely how many training sessions did we do? In this case, we're saying we did 7 training sessions. Then our third activity, outside of doing the training, we're going to contact all 20 tobacco vendors within 1 mile of Wayne High School to ensure they're not selling to minors. We call this a quantitative measurement activity, almost identical to the project-based activity, except for one thing, and that is that we have, pardon me, we have a target quantity. So think about all the different things you do. I mean, if you're going to do vaccinations at the end of the month, you might want to know how many we have, or you set a target, say we're going to do 100 vaccinations this month, and I want to know at the end of the month how many we did. How many car seats did you distribute? So you want to be able to do that. So it's really kind of a powerful tool, and it also helps in calculating where you are in the process here. So down here, you see at the bottom, it says we've done 20 tobacco vendor visits down here, and it calculated to be 100%. So it take 20 and divide it by our target and says we're at 100%. If we'd only done 10, then it's going to calculate to be 50%. So it's the second most used type of activity, and very powerful. And again, it's got a beginning and ending date, just like the project-based activity. All your notes, your data source is available, your internal and external partners, team members, and everything else in there. So those are the 3 activities that we believe are going to get us to our target objective here. Now, if I go back and take that through the pyramid, it looks like this. The group we selected was Tobacco 2024. So everything below it is filtered within that group. Now I'm going to go down and select one of the 3 initiatives, tobacco cessation. So everything below it is within tobacco cessation. So you can see we're filtering as we go down. Under tobacco cessation, we had several goals. We're picking reduce smoking in high schools. Under that, we're picking reduce smoking in Wayne High School by 25% by the end of the school year. And then the steps we're going to go through to get there. So that is the planning model. It's integrated into the system. Every plan fits into this model. It is kind of the most popular operational planning model. Sometimes you'll see variations in the nomenclature, and we'll go through that in the next training pretty well here. Now, just to give you an idea of why the pyramid is kind of the right model here, think about this for a second. These plans you see in the bubbles up here, what FAB calls their 6-pack of plans. These are the minimum plans required for accreditation. So let's say we're looking at our strategic plan, which is a group within itself. So I've got a group called strategic plan. My first level down, my services or initiatives are typically your strategic priorities, somewhere between 3 and 7 on the norm. Let's say we have 4 of those. Let's say each of those has 4 goals. Let's say each of the 4 goals has 4 SMART objectives. Each of those objectives has 4 activities. I think if you do the math, that's about 256 activities. So hence you can see why the pyramid gets pretty wide at the bottom down there. Now, we've got our plan in place. Let's take that plan and walk it through the PDCA cycle to see how we're going to make it better and better as we go through it. So the plan is done here. The next thing, obviously, we're going to do is execute the plan. So in this particular case, Diane and her team are going to finish up the training content. William is going to take that training content and go out to the schools and do his training. And then Tom is going to go talking to those tobacco vendors to make sure they're not doing bad things with minors and such out there. And that's where the real-time planning comes in. Each of those folks, including Steve at the objective level, is going to get that email notification. In that email is a link that takes them right back in here, typically through what we call Quick Update, which we'll review a little bit later here. Quick Update is just a very simple way to update the status of the activities and the objectives. Now, the reason it's critical to collect all that information is because of the check phase. The check phase could be very, very simple, or it could be very complicated. It's very simple if you're collecting all that information in the background. If you're not, then every time you do the check phase, you got to go collect that information manually and then come back to it. So if you're in fact collecting that information in the background, it would look like this. Reduce smoking at Wayne High School by 25%. Where are we? Click on this little chart button right here, and boom. We started out back in August of 23 at 0% reduction, got ourselves ramped up, got to our 25% target. So that's really all there is to it, to the check phase, if you're collecting all that information in the background here. Now, that is the check phase. The adjust phase is making corrections. Now, there's kind of 4 scenarios in here. The first one you just saw, everything's working beautifully, don't need to change a thing. So I'm just going to kind of skip right past the plan phase here. I'll continue to execute and collect the information in the background. I'll go into my check phase every once in a while and check, once a month, once a quarter, whatever it happens to be, to determine if we're on track, continue through the cycle. Now, let's assume for a second that the top of that chart I just showed you, which by the way is called micro level performance monitoring. So I'm down at the objective or activity level. Let's assume that that chart was only at 21% at the peak and not 25. So we didn't quite make our target. Now we've got to make a decision. And the decision kind of comes down to one of 2 things. Is the plan too high? Is it just not attainable to get to 25%? If we decide that's the case, we're going to adjust the plan down to 21, continue the execution, check it every once in a while, and try to keep it at 21. The other option might be, we can still get to that plan, but we just don't have enough resources yet. So maybe we go from 9 to 12 training sessions a month. Maybe there's more tobacco vendors out there than we thought. We're going to get to those folks. Maybe there's a whole nother set of activities that we could implement that'll get us there as well. And then there is a 4th option. And the 4th option is kind of an in-between, I guess. Maybe the plan is just a little bit too high. Maybe 23 is a realistic number. And maybe if we go from 9 to 12 training sessions a month, we can get to 23. So those are kind of the 4 options. Now, the cool thing about having this integrated in the system for every plan, in the real world, when you're doing FAB accreditation, each of these plans has a defined life cycle by FAB. So your strategic plan is a 5-year life cycle. Well, think about that. You are literally updating that plan every month. Typically, the real-time planning cycle is monthly, but you can set it for anything you want. So that strategic plan, in fact, is being updated on a monthly cycle. So does it, in fact, have an infinite life cycle because you're moving the plan forward all the time? So it really does help you to keep all of those things up to date in there. Now, at the group level, we have the dashboard, kind of the namesake, if you will. The dashboard, let's go back live into the system. I'm going to go back to my groups tab. So as you recall, when I logged in, I was at the community health group here. So that's my default group. The reason we do that is because if I'm the community health director, I'm probably not, creating plans, and I'm probably not updating plans. My staff is doing that for me. But I want to know, how is community health performing? So instead of having to navigate anywhere when I log in, I can just go to this traffic light button up here, click on it. It typically takes it about 10 or 12 seconds to go into the background and put together, hundreds or thousands of data points to give me a finite definition of the performance of community health in real time. And here's what it looks like. So up here, it's telling me, what am I looking at? In this case, it's USA Public Health Community Health. Now, this is kind of a nice little tool up here, too, for the same exact reason we're talking about. Again, I'm the community health director. The only thing I want to see is this chart when I log in. So I can set this to be my home page when I log in, meaning that when I log in, instead of going to the main menu that I showed you before, it goes directly to this page for my area of responsibility, in this case, community health. So it just kind of, saves you searching around and doing mouse clicks in here. Now, this is what I call the big picture up here. So it's the number of traffic lights in each status at either the objective or the activity, objective, or goal level. So you pick which one you want to look at here. I'm looking at the activities, and you see the number of traffic lights in each status, red, yellow, green, and gold. And you'll also notice I get the little click finger when I roll over, meaning I can drill down on, if I want to see what this red activity is, I can drill down on it, get the information, maybe assign somebody to go fix it or whatever it happens to be. The other thing I see is the schedule gauge. The schedule gauge is showing me that across these 10 activities, aggregately, we're about 3 days ahead of schedule. And it's calculated pretty simply, beginning date, ending date, percent complete, and then aggregating those together. So it's giving me an idea that if I'm green here and I'm mostly green and gold, I'm doing really, really well. I might want to, again, drill down and find out what's going on with the reds and yellows. Now, I can drill down even further down here at the bottom. First view that I have is my activity leaders. So those folks that we assigned as the activity leads at the activity level, obviously. And here's the list of them. Now, over here is telling me this is the last time this person updated their information. You notice it's color-coded. The green is less than 30 days ago. Yellow is 30 to 60, and red is over 60 days. So kind of in an ideal world, it'd be nice to have everybody in the under 30, so I know I'm working with pretty real-time information. The FTE value, that same value we talked about at the activity level, can be rolled up. So if I'm assigning a person to a bunch of different activities at a different FTE level, I want to make sure that I'm keeping them under that 1.0 FTE, that I'm not overloading people. It causes stress and causes people to leave. Lagging says I have an activity that is calculated to be behind schedule. The days here for Diane says overall across all of these activities, she's 68 days ahead of schedule. Overdue says I have 2 activities that the end date of the activity is before today and it's not yet 100% complete. And then the number of red, yellow, green, and gold for that person. So that's my first view is my folks. The second view, this groups button here, when I click on that, and again, we're going to go into great detail on the dashboard screen when we go into performance monitoring training. It's saying that I'm at community health, and community health had 2 subgroups of tobacco and WIC. So it's going to show me community health and its 2 subgroups, tobacco and WIC here, and then basically the same information over here. Then I have a third view, priorities. Priorities are the strategic priorities from your strategic plan, which will appear down this column. Typically, again, 3 to 7 of those in there. And then this is mapping everything else in the system against your strategic plan. So the idea is, in fact, how effective is your strategic plan, and is everything that you're doing, in fact, reflected in your strategic plan? Top right corner up here, my priorities. More or less, it's a bookmark of things that you want to personally keep your eye on. Their objectives. On the objective screen, there's a flag that you set. When it turns green, they appear up here on your login only. So everybody picks the ones they want to watch. You can pick any objective in the entire system that you have access to. Most often, they're going to be things that are yellow and red because they're in trouble. And they're going to be things that either you're working on or your team members are working on. So it just kind of keeps them front and center. And by the way, these are real-time lights. So if this thing, somebody's in there in the background working and this thing turns to green, I'm going to be able to see it turn to green. I can look at it and say, don't need to watch it anymore. It's all fixed, and away I go. So this is the dashboard. This is macro level performance monitoring. Now, again, over COVID, we had a lot of extra time, so we built another function in there, and it's called VMSG Mobile. VMSG Mobile is what we call a dynamic app, so you don't need to download an app from the App Store or anything. I know some health departments, the IT folks lock down their phones, so they can't do that. So it's actually a dynamic app that's built in the web browser on your phone, just like the other one is built in a web browser on your desktop here. But it's exactly the same functionality, the top left corner, bottom, top right, just split across 3 phone screens for, the amount of data you can put on a screen in there. Everything on here is clickable, so I can drill down to all the data points behind here. I can turn these my priorities on and off just like I could on my desktop. But, if you're out and about and you want to have your dashboard available to you, there it is right there on your phone. Now, I apologize, but I forget. Are you guys going through re-accreditation or initial accreditation? Re-accreditation? Okay. Built into the system, we have every accreditation plan known to man, starting back in the old 1.5 days and now with all the 2022 plans. I just kind of have a sampling of them in this demo thing here, but FAB re-accreditation local. So this is the old 1.5 plan. There's the pathways plan in there. There's a state, local, and tribal version of every plan. You guys would be here, the FAB Reaccreditation 2022 local plan here. So if I click on that, I start drilling down on the plan. It starts out with the accreditation process. Now, by the way, all of this information is extracted from the FAB documentation. We didn't make up any of it in here. I start drilling down even further. It gives you the basics here: preparation, application, document selection, site review, etc. Preparation is broken down into the objectives in here, and then you get down to the activity level. So it's a complete, detailed operational plan to walk you through the entire accreditation process. Now, when you get down to the domains, under the domains, obviously, are the standards here. One of the other things we did is we used that data source I was showing you to link back to the FAB documentation. So if I click on this link here, it's going to open up a new browser tab and take me back. And this is on the FAB website, right to standard 1.1. So it takes you exactly to where you need to be to get the additional information that you might need to complete that. Underneath the standards are the measures. Now this is where the documentation comes in. So this one says the required document is one community health assessment dated within 5 years. Well, that document is attached right here with the document management. You can see it says there's 3 documents attached. So when I click on that, it's going to show me right now just version 3 by default, but I can say show me all the versions here. So you see the 3 different versions of your community health assessment. Now these are attached to the measure where they belong, which means when you're ready to submit documents into the EFAB system, you just come in here, you take this gold one typically, you'll download it, shove it up into the EFAB system, and you're all set to go. All these documents are stored very securely on our secure servers. We've been doing it for like 15 years and never lost a document. So they are backed up every night, the whole 9 yards. So if you put the documents in here, you know that they're going to be there when you're ready to submit them. Now, the traffic lights on the documents for accreditation are typically yellow is a draft, and you can have as many drafts as you want. Green would indicate that you as the department have completed the document. And then the gold would say we have submitted this document up into the EFAB system. So now there's another document management tool off the main menu that lets you look at, show me all the documents in the FAB reaccreditation plan. And by default, it's going to show you the latest version. So you look down here and see, if you see all gold traffic lights, everything's ready to go. If you see a green in there, that means, hey, we've completed it, but we forgot to submit it up into the EFAB, or we just forgot to mark it, one of the two. So again, all your documents are in here. You can have as many documents as you want, any size, any type. We don't limit any of that stuff. Now, not everybody in the world knows what is in a community health assessment. So what we did is broke it down to the next level, and these are FAB's requirements for a community health assessment. So the first one says a list of participating partners. And again, here's document management. The list of partners is attached in there. If you go through these 7 items here, collect everything that you need for that, you'll have everything you need to build your community health assessment. Again, if you haven't already done that in here. Now, to get you guys going, what we like to do is you're going to tell us when you're planning on submitting final documentation. And then we typically back that up about a month. Just give you a little leeway in there. And we'll set that end date on all the activities for that cycle in there. Now, you're going to have the date in there, and then you're going to say, okay, at the domain level, you're going to have typically domain leads or domain managers assigned. You'll tell us who they are. We'll push it all the way down. You can do this too, but we got a tool that pushes it all at once for you. We can put that all the way down to the objective and activity level. So now you've got the objectives and activities assigned to the domain lead. By the way, the domain lead can go in and adjust those. So maybe he's the objective lead and he assigns some of the activities to his team members or something like that, but you can do any of that you want. But as soon as you do that and you turn on the real-time planning, the emails, the system becomes automated. So the whole process of accreditation, or in your case, reaccreditation, becomes automated. And it's going to notify the people when they're ready to be updating documents or ready to submit documents, the whole 9 yards. So it's a pretty powerful tool. And you can have as many of the plans as you want. If you like the old plans in there to look at, that's fine. You can have as many as you want in there. We don't charge for any of that stuff. So that is the accreditation plans, and they're built in there. Now, one of the things we had happen over COVID was we had a lot of our departments still pursuing a 1.5 accreditation, trying to get finalized in there. You know, they've been working on it for several years. What a lot of people like to do before they go into the final fab site visit is do what they call a mock site visit, meaning they're going to hire some expert. We have some folks that we'll recommend to you if you want to. They're going to hire an expert to come in. Typically, they'll fly them in, they'll hotels, and they'll pay them an hourly rate to go through and review everything in their plan. And if it's in the accreditation plan, it's very easy to do. You got all the documents in there and everything else. But they're going to go in and review that. Then they're going to grade you, and they're going to come back and say, you need to adjust this, this, and this before you do your site review, or, hey, you guys did a great job, you're all ready to go. So what we did basically, because people weren't traveling and a lot of health departments were working from home, we virtualized the process. So we built a tool right into the accreditation plan, the review tool here. So you're going to pick the person. We're going to give them access to your accreditation plan. And it's a very limited access. Is all they can do basically is add this review pane in there. But they're going to go through and review all your documents. They're going to review all of your plans, and they're going to grade them. When they're done, there's a report that gets generated called the Accreditation Review Report, and it shows you all of your stuff plus all of their review in one place. Just a real simple, effective way to kind of do that mock site visit if you're interested in doing that. Now, everything I showed you is what we call the core functionality of VMSG. So here's what most people do. We got about 240 health departments across the nation using the system, mostly for accreditation, some of them for FAB accreditation. We got the whole state of North Carolina who does their state accreditation. There's about 87 health departments, I think, that do that. But for those folks who are doing FAB accreditation, they typically start with the 6-packet plans in the system. And then they use the accreditation, or in your case, reaccreditation plan to manage the process. You turn on the real-time planning. By the way, there's a measure 9.1.6 that says that everybody, not everybody, but people at all levels in the department have to be involved in performance management. Well, think about that. If I'm getting that email and I'm going back into the system and managing my portion of the performance management tools and the plans in there, I am involved. So it's kind of an automatic for 9.1.6. But for people who do all of those three things in there, every one of those has gotten fully demonstrated by FAB for performance management. So we know that it works, and it's a really great process, and it'll really help you to get through the accreditation process. So that's the basics here. Now, a couple of things I want to go through. There's a couple of other features that have been added that I want to talk about, and we'll get into detail when we go into the next trainings here. And then I want to talk through the real-time planning a little bit, show you how that works, and the quick update, which is a super simplified way to do the updates through the quick update. And then I'm going to walk you, for those of you who have not actually been in the system, I'm going to walk you through the login process, how to log in and change your password. And we'll look a little bit about the built-in help, and then I'm going to let you guys go for the day. So first of all, intelligent document management. Document management has been there for 15 years or something in the system, primarily for FAB accreditation, but you can use it for anything you want. A lot of people use it for grant management and things. But about 6 months ago, one of our clients in Michigan came to us and says, here's a problem we have. We have a bunch of standard operating procedures, and typically they're assigned to be updated on a fiscal year basis. We know who's supposed to be updating those SOPs, but we don't have anything that says, hey, Fred, you need to update SOP number 1 by the end of September. So what we did is built that functionality right into the system. So there's an activity, part of that quality assurance activity we talked about, called a timeline. And what you do is you set it for, in this case, an annual cycle starting, July 1st, maybe if that's your fiscal year beginning here. And it's going to be an annual cycle. And then you're going to say, let's say 80% of the way through the year, the light on that activity turns yellow. Fred gets notified that it's time to do the update. That document for the SOP is attached to the activity. He downloads the document. He does the updates. He uploads a new version, automatic version control. All the lights turn back to green. The new cycle starts. So it's just a really, really awesome way to be able to manage any kind of documents that you have out there that are critical. So look at, policies, SOPs, memos of understanding, grant documents, FAB documents, all of it's in there. And again, no limitations. The other kind of cool thing that this has is a kind of a sideline is that you can give everybody view-only access to the group that you assign for these documents, meaning that everybody can go in and find all of those policies and MOUs and everything and use them for what they're meant to be used for without having the ability to update them and all that kind of stuff in here. So just the ability to get to them all in one place in there. So this, by the way, has become the most popular feature in the system since we rolled it out 6 months ago. As you, I'm sure, are aware, you're going to need reports for everything, and we have reports for everything. We go through this in the performance monitoring training as well as the 3-dimensional planning training, but we'll go through every report that's in the system and all the different details and functions. VMSG Public is, again, a simple way to create public-facing web pages. It's like a totally graphical report without all the detail. So it's kind of a status report with pie charts and schedule gauges and all that kind of stuff on there. But it's a very simplified view. You can have as many different plan elements on a report or on a web page as you want. And literally, once you do it one time, it takes you 5 minutes to create one of these. It creates a unique web address that's hosted on our servers. You can send that address to the board. You can send it to the health director who just wants to see how are we doing and doesn't want all the detail behind it. And then three-dimensional planning. This is kind of the last training that we do after you've been in the system for a while. And that is the ability to kind of cross-link and cross-reference all the plans together. So we talked about the bottom of the dashboard where the strategic priorities are mapped. That's how we do it. Three-dimensional planning says, okay, here's my 5 strategic priorities, and here's how they map to every other plan in the system. That way you can go back and just look at the cross-references. And you can do that for anything. Maybe you have a state requirement for different things, so you can map it to your state requirements, generate a report out of that that says, here's how we meet the state requirement for ABC or whatever it happens to be. So those are some of the other features we'll be talking about as we move forward in the training here. Now, I do want to kind of quickly go over the real-time planning and show you, again, it's critically important to be able to use this to offload the ability to have to go collect information manually, because it just wastes time that you guys don't have. So here's how it works. You set it for anywhere between daily and monthly. Most people set it for a monthly cycle. Let's say we set it for the first Monday of the month. So the first Monday of the month at 1 a.m., the system goes in and it looks at everybody who's designated as an objective lead or an activity lead, and it asks 3 questions. Number 1, has this person been in the last 30 days and updated their stuff? Number 2, does this person have anything that has fallen behind schedule? And number 3, does this person have anything that's overdue, meaning today is past the ending date of the activity and it's not yet 100% complete? If none of those are true, no spam. If any of them are true, out go the emails. As I mentioned, the emails go to internal folks as well as selected external partners. And by the way, we'll train those external partners at no cost to be able to do it. It's a super simple process to update their information. Now, the only people who get these emails are those folks who are designated as objective or activity leads, which hopefully will be everybody in the department. So when you go click on the link in the email, it's going to give you the option to go to quick update. Now, there's 2 quick update screens. There's activities and objectives. You're going to go through your activities. And by the way, as you're updating it, there's only 3 fields to update on the screen: the traffic light, the data value, and the notes field. You're going to go through all your activities. You're going to go through all your objectives, and you're going to log out. Just to give you a number, across 240 health departments, this averages 3 to 5 minutes per person per month. So it's an extremely effective way to collect that information and keep the information real time in the system. Now, the activities quick update screen looks like this. Again, I mentioned the top of it is just the pyramid, so it gives you context. But the bottom of it, I can cycle through my 4 traffic lights, put in my data value. I did 9 training sessions this month or whatever. If I want to put a note in there with a time and date stamp, I can do it, or just a general note. Got access to that data source in here. This is my next page button. I'm going to walk you live through this here in a minute, but I just kind of want to show you that it's really very simple because you're just updating a couple of fields in there. Now, the real-time planning email that comes out looks like this. First of all, those are the 3 criteria. Why did I get this email? To tell you met 1 or more of those criteria. Just kind of an FYI, this, for all of the activities that you've been assigned, here's the current traffic light status. Your administrators will show up in here. It shows us for here, but in your case, it'll be the name, email address, and phone number of your system administrators. So if you have any questions, why did I get this email? It's not working right, whatever, you can contact them. You can always contact us as well. And then there's that link, login.vmsgdashboard.com. So now when I click on that link, again, it's going to give me the option to go in and go to main menu or quick update. But I'm going to walk you through the login process now. I'm going to go through it 2 ways. Number 1, just a bullet point set of things to do. And then secondly, I'm actually going to go live and log out and log back into the system. So as we mentioned, the link is login.vmsgdashboard.com. If you don't want to remember that, you can just say login, vmsgdashboard.com. In the top right corner, there's a link up there that says if you're already a user, click here. You're going to get a dialog box that has 3 buttons. The leftmost button is called send, which means send me my stuff. When I click the send button, it's going to ask me to enter my email address. I'll click send again. Hopefully I'll get a success dialog. That means I found all your stuff. I sent you the email. If you get anything else, please contact us. That means something's wrong with your account or it's maybe not even in there yet. Just contact us and we'll get you fixed up here. Next thing you're going to do is you're going to dismiss that screen, and then there's going to be a login button on the top. You're going to click on that. Again, I'm going to walk you through this live. You're going to enter either your user ID or your email address. So you don't have to remember a new user ID if you don't want to. You can always just use your email address as your user ID. And then you're going to enter your password, and you're going to click login. So that's the process here. Now, the credentials email that you'll get will look like this. Very, very simple. User ID and password. And again, you can throw away the user ID if you want to. I do highly recommend the password is system generated initially. So it's got potentially some cryptic characters in there. So what you want to do is highlight the password in there and copy it, Control-C or whatever to copy it in there. Now, once you have the password in there, let's go walk through the login process live here. So up here in the top right corner are the quick buttons, we call them here. So you got the dashboard we talked about. This is your reports menu. This is your main menu, help and information, which I'll walk you through in a minute, and log out. So the red button is your log out. So I'm going to go ahead and log out. It says, yeah, sure, I want to log out. This is the VMSG dashboard homepage I was talking about. Up here in the top right corner, already a user login here. We'll click on that. It's going to take us back to the login page with that dialog I was mentioning. And here's my send button. So I'm going to go ahead and click on my send button. And I'm going to put in my email address. And I'm going to hit send again. Hopefully I get the success dialog, which I did. Now, if your login is not in there or your email's wrong or something like that, you may get a warning or something like that. If you do, please contact us. We'll get you fixed up. In this case, it said it sent me my information. Now, that email goes out immediately. So if you don't get it in a minute or two, check your spam folder, things along that line. Could be lost. Click on this. Here's the login button I talked about. I'll click on that. It's going to bring open that same dialog. This time, I'm going to put in either my email address or my username. I'm going to paste that password. Remember, I copied the password out of the email just to make sure I got all the characters right in there. I'm going to paste it in there, and I'm going to click login. Now, because I've been assigned as an activity or objective lead, I'm going to get this dialog which says you can go either the main menu or the quick update. Let's go look at the quick update. So I'm going to click on that. It's going to take me to my activities quick update screen for just the activities that I've been assigned. So again, the top of it is merely the context, the group, service, goal, objective, activity 1 of 2. Here's my activity. Down here are the 3 fields I'm going to update. My traffic light, my data value, my notes field down here. I've got the data source if I have one in here. I've got the link in here that I need. Now, before you go anywhere else, you're probably going to want to save or change your password. Here's the key button up here. This key button appears on the main menu on the main menu screen, or it appears here on the quick update screen. So if I click on that, just like any other one, paste out of the email that we showed, just go ahead and Control-V, and it'll paste the password in there, put in your new password, verify your new password, hit update like every other website in the world, and you're all set to go. Now, so I'm all set, got my new password going. I'm going to do my update, change the traffic light if I need to, change my data value, put in a note, time and date stamp the note, hit my next button. Here's activity number 2 in here. Again, same thing, I can do the updates. It's my last activity 2 of 2. So when I click on this, it says, hey, you're also an objective lead. Let's go look at the objectives. I go to my objective screen here. And it's a very similar screen with the objective up here where it belongs above the activity. So here's my objective. Again, data value, traffic light, notes field, time and date stamp for the notes if I want to. Now you'll also notice that the activities for that objective are down below it, kind of where they belong. And there's 2 different colors here. The blue indicates that it's assigned to you, meaning that you just updated it, so you don't need to worry about it. The gray means that you, as the objective lead, have probably assigned them to somebody else on your staff, and they haven't been updated yet. So you can go in if you want to. Maybe this person's on vacation, you want to do the update. So you can click on that. It's going to take you to the activities quick update screen for those objectives or for those activities. You can do the update, and away you go. So that, and then when I click here, it's going to, because I only have one objective, it's going to ask me, do I want to log in? Do I want to go to or log off? Do I want to go to the main menu or whatever? Now you kind of got the same buttons up here. You got your password button. This is document management. So even on the quick update screens, I can do document management. My main menu, my log off menu, and help and information. So I'm going to go back to the main menu here. As I mentioned, your password button is still down here as well. So you can change your password from this screen. let's say I'm on my services and initiatives screen here, and I have a question about anything that's on here. So all I need to do is go up here to the blue eye, and it's context sensitive, meaning that I was on services and initiatives. It takes me right to services and initiatives. First thing you'll see is a step-by-step process to do anything on that screen. So if I want to add a new service, I want to remove a service, and an in-depth definition of every button on that screen is down here as well. So what does it do? When do I use it? That sort of thing. Down here, we have a 5-minute video training module on adding and managing services. Down here, we have the entire user guide on a single hyperlink PDF file. So you click on that, dock it on your desktop if you want to. It's all available here, or if you just like having it or you want to print it off, that's fine too. This down here is implementation guidelines. It's things we've collected over the years as we've implemented with different customers. What works great, what doesn't work so well, what types of people tend to glom onto a system like this pretty easily, what types of people don't typically like to get into a system like this. What are some of the IT issues we ran into with firewalls and emails and all that kind of stuff. There's some templates in there for creating operational plans. There's a step-by-step process on entering an operational plan. So lots and lots of good stuff in there. It's worth a read if you're just getting started with the system in here. Now, up here at the top, these top 5 bullets are video training modules. So we're going through this one today, so you can skip over that. The next one, the basics, if you want to do that, is just kind of every button and every screen on there, but they're all covered as well in these modules. The operational plan development, which is the next live one we'll go through, which is 2 sessions, by the way. Training 2, we call it, which is how to do an operational plan. And we actually go through and enter one. And then we give you homework to enter your own operational plan or create one. Then we do a review of those operational plans. And then the 4th training is performance monitoring. There is actually a 5th training or another training down here for those of you who are administrators, how to manage users, how to manage permissions, groups, all that kind of stuff in there. And there's another one in between here that we go to. It's a pretty short training, but it's that 3-dimensional planning we were talking about. It makes a lot more sense once you have your own plans in the system to go to the 3-dimensional planning, because you can kind of look and understand in your mind where I'd want to link these things together. But if you go through starting, let's see, these 3 modules for most people, it's about 2 hours and 15 minutes, I think, of video training. It's very, very detailed and probably put you to sleep like this one does if you need to. But all that is built into there. Now, one of the other things that the quick update we went through on the desktop is also available on your phone. So same thing, you're going to be in here. Here's an example. You're driving into the office in the morning. It's the first Monday of the month. You stop at Starbucks to have a coffee. You pop in there, you grab your coffee, sit down at the table, pop open your phone. Here's that email from VMSG. Click on the link. Again, you don't need to have an app on there. You click on the link, you log in. It's going to take you to Activities Quick Update. You do your updates on your activity. You do your update on your objective. You log out. And 5 minutes later, you're done for the month. So just a nice convenience feature to have. And we talked about help and information. And that was your drink out of a fire hose / garden hose for the day. What questions can I answer? Nobody's drowning. I don't see any mask and snorkel, so I did pretty good. Okay, well, if there's no questions, the next training we'd love to schedule is the operational planning. It's another about an hour long, but we actually go through and look at every level of the pyramid and go through real live public health examples of, what does the service look like? What's an initiative look like? What do the goals look like? That sort of thing. And then at the end, we'll actually put in an operational plan and system so you can see every button push, every click that you need to do. And then there's a homework assignment, which is to create an operational plan. And we'd like you to have fun with it. Create something. I'm going to plan my kid's birthday. I'm going to plan my Las Vegas vacation or whatever it happens to be. We've had all kinds of fun stuff in there. And then we'll do a review of those plans just to make sure you got all the different levels kind of proper. And then we'll schedule the performance monitoring training, which is all the charts and graphs and reports and VMSG public and that sort of thing. So here's all my contact information. If you do get into it and you have any questions, or again, if you can't get into it and you get that error message when you try to log in, please contact me. I can fix it up in a jiffy to get you up in there, up and running. Okay, everybody. Thank you so much for taking the time today. We do appreciate it. And we look forward to.
Hi,
Yes.
Fred, real quick. I know you mentioned that you're going to go over this, of course, at the next training, but I did have a question. Um, the color of the lights, like the green and the gold and the red, that sort of thing, when you hover over them, does it give like a description of what that is, or is there like a key code somewhere else?
Well, let me kind of give you the quick answer to that. Having rollovers on what they call mouse overs on all the buttons. There's
Uh-huh.
the server we use is called Claris, and there was a bug in there that they haven't yet fixed, by the way, that under the certain condition where you had the mouse over and certain other conditions, it literally shut down the server for everybody. So we had to take all
Oh,
those off there. But again, every button is defined. So if I'm looking at services and initiatives, every button is defined on this screen. So all the buttons are defined in more detail down here. So unfortunately, we can't
okay.
do the mouse over right now, but all those buttons are in there. Just click on this blue button from the screen and it'll show you exactly what they're for.
Okay, that's what I was asking for. I probably missed that area. Thank you.
Okay, good question though. And you know, as soon as they get that bug fixed in the server, we'll be putting those back on there because we get a lot of questions about that. Okay, everybody, thank you again so much for your time, and we'll get the next one scheduled ASAP and get you guys going. Thanks, everybody.
Thanks, Fred.